I'm Dr. Bradshaw, and this film is used for the Class 1611 and also review for the Class 2612. Today I'm looking at a lateral lumbar film. I wanted to start with a close-up of the lumbar segment so that you could see the parts at a close-up of this. If you start with number 1, of course all of this is vertebral body. Number 1. Number 2, all of this would be the pedicle portion of the segment. Number 3 is the superior articular process. And of course, here's your joint space between 3 and 5. Joint space is called the apophyseal joint. Number 5 is the inferior articular process for this segment, and superior, again, is the superior for this segment. Number 9 is going to be your superior vertebral end plate, and number 8 is your intervertebral disc space. Now, if we stay on one segment, here's the superior process, here is the inferior process, and what connects the superior to the inferior, this middle portion right here, number 7, is the pars interarticularis. In the middle of the pars, you see this increased white density. That is the transverse process coming straight at you. Now you also see a density coming down right here. That happens to be a rib that is superimposing part of the lumbar spine. And so that is a rib. Spinuses are back here in this area. In fact, number 4, which is labeled right here, is labeling the spinous. But spinuses are huge, but spinuses also are very flat, very thin, so they don't have a lot of density. And so that's why you don't really see an image back here for the spinous, but the spinous would be right here where the arrow is right now. If you're real up close to the pars, you would really be on the lamina portion of the segment, and so you can almost see that slight image of the spinal laminar junction line right there. The IVF, of course, is this, and again, the pedicle is this. So that is the close-up. I'm going to stay on the video and just go ahead and switch it to a lateral view, and keep the video running. Number 1 is going to be your vertebral body. Number 2 is up here on the pedicle. And if I stay on this segment, number 3 is on the superior articular process. And there's a superior here, there's a superior here. And so you see the joint space right there at the tip of the arrow. That is the apophyseal joint. If I go up to this segment, you see there is the apophyseal joint. Number 4 is on the spinous process. Now it's a little bit further back on this film, and so it really is on the spinous. Number 5 is on the inferior articular process of the last lumbar, and again, here is your apophyseal joint right there between 5 and 14. The sacrum does have a superior articular process, and that is number 14 on this film. The superior anterior aspect of S1 is called the sacral promontory. Number 9 would be the inferior vertebral end plate, and number 8 would be the intervertebral disc space. 6 is labeling the IVF, and 11 is labeling this rib that's coming down right here. Number 7, again, superior process here, inferior process here. What connects the two is the pars interarticularis. If you see this really white image right here at the tip of that number 7, that is the transverse process coming straight at you. Now, not numbered, but you see the diaphragm coming down right here. And of course, on the lateral view, that is called a posterior costophrenic sulcus. Posterior costophrenic sulcus, lowest point of the chest cavity, first to fill up with fluid if you have some disease process such as pneumonia or cancer that causes fluid in the lung field. And so we would look at this spot just to make sure that there is not a fluid line in the posterior costophrenic sulcus. This ends this video. Have a good day.